I threw together a couple of physical models to explore the difference between the distribution of dermomyotomes and the distribution of named nerves, and how that concept can be used to explain variation that you'll see in the physical structure of nerve plexuses. So reviewing really quickly, you can see here, this is labeled C8. It doesn't really matter for this exercise, but you can see we've got a dorsal root, a ventral root coming off the spinal cord. Remember, these are afferent signals, so A approaching. This is sensory information returning to the spinal cord. We have efferent signals, E exiting the spinal cord. This is motor information going out to the body through the ventral root. They come together to form the spinal nerve within the intravertebral foramen. Once the spinal nerve exits the intravertebral foramen, it'll give off the dorsal ramus and then the ventral primary ramus. And then here, what you can see is we've got these elastic stretchy strings representing axons. Here we can tweak them, so we've got sensory fibers returning from the ventral ramus, and then motor fibers going out to the rest of the body. So we've got these fibers representing a dermomyotome. We take another, add that to this in sequence. We've got T1. It's a little bit different than C8, but for this exercise, the levels don't really matter all that much, nor the differences between them. If I had better supplies, more supplies, I would have made these different colors. But you can see this is basically this dermomyotomal distribution where you get this segmented pattern repeating. Now, if you ignore these numbers, you can imagine what this would look like as you continue this pattern segmentally down the body. Now, since this exercise is to show how differences between the distribution of the named nerves and those dermomyotomal levels occurs, I've put together this model. So C5, 6, 7, 8, T1, that should be familiar. These are spinal levels that typically contribute to the brachial plexus, unless you have a prefixed or postfixed condition in which contributions may be shifted up or down a level. So here we've got different colors, those stretchy elastic strings again, representing each of these spinal levels. So C5 to T1. So here, brachial plexus consists of roots, trunks, divisions, cords, and then branches. If you think back for a second, you can see that a dermomyotome, you can kind of think of it as having a fixed starting point in the spinal cord and a fixed end point where everything innervates. But you can get quite a bit of variation in the route they take and how they join up in plexuses with other axons from other spinal levels. So if we pull this back, we can see a brachial plexus here where we've got roots, our trunks, our divisions, then our cords, our lateral cord, our posterior cord, and medial cord. And then those come together to form the named nerves. So we've got the axillary nerve here, musculocutaneous nerve here, radial nerve, median nerve, and the ulnar nerve. And you can see that each of these is getting contributions of axons from different spinal levels. Now, this is also how you can get a lot of variation within a plexus without changing the start or end point. So if we uncover the end point, you'll see that even though these axons take very different routes through this region, they all end at that same dermomyotomal level they started at. So whatever the nerve may be, here we've got musculocutaneous. You can see that all of its individual axons are going to the dermomyotomal levels that they started from, are still going to those C5 to C7 dermomyotomal level distribution distally. That's true for each of these nerves. No matter what you do in here, they're still going to that same endpoint. They have the same end, they have the same start point, they have the same end point, no matter what happens through here. That's how you can get variation in the brachial plexus. You can move things around. Maybe things come in a little weird. Might come in from a number of different places instead of having normal number of divisions, split in an odd way. There's a lot of potential for variation. But you'll see that no matter what happens, those things all go to their expected dermomyotomal distribution and endpoint. Now, in this figure, you can see that there are many, many variations in the route that's taken, but the endpoint is always the same. Everything functions just fine. So just to prove that really quick, I'm going to undo this brachial plexus and turn it back into a simple segmental distribution of dermomyotomes. And then you can see everything starts and ends in the same place still.